And I would like to give the floor to our last speaker of today, who will share with us the lessons learned from the session today. And we are happy that Professor Agustin Kusumayati is here to share with us the lessons from this not afternoon, maybe evening, today's sessions. Please, the floor is yours.
Thank you, Professor Verhoef and Dr. Annikler, for giving me the opportunity to wrap up our sessions this afternoon. First of all, very warm greetings from Jakarta. My name is Agustin Kusumayati. I am a lecturer at the Faculty of Public Health, Universitas Indonesia. So I'm very happy to meet all of you and to learn together about digital MCH. Share some notes that I have made as the conclusions or summary of our sessions this evening. So we are talking about digital MCH handbook. When we start discussing about this digital MCH handbook, so the first question is or will be, why should we apply or should we develop digital version of the MCH handbooks? There are two main reasons why we have to develop the digital version of our MCH handbook. The first reason is what we call as the fourth industrial revolutions. We know this that many technologies, many new technologies coming together and then have already changed many aspects of our lives. It's already changed the way we work, how things, the way we travel, and the way we live. And of course, the fourth industrial revolution also affect health very much. By using these new technologies, the ICT technologies, researchers can find much faster a new medicine, new technology for diagnosis and treatment for diseases. A new technology and also, of course, new data will allow largely for medical research, and the data is actually the underlying theme behind changes of healthcare. So universal connectivity, greater access to information also will empower the patients and give them greater role in their healthcare. This new technology also disrupt and change existing relationship between healthcare providers and all stakeholders, including the patients themselves. So this is one of the reasons. And the other one is, as WHO already mentioned, that e-health is a very cost-effective and secure use of information and communication technologies in supporting the health and health-related fields. We can use this technology for healthcare services as well as for public health objectives such as surveillance, health literature, and health educations. So the second reasons why we have to apply digital MCH handbook is the COVID-19 pandemic. So the transmission control of COVID-19 require us to reduce our mobility and also to reduce contact between peoples. So besides this, using masks and physical distancing, washing hands, we also required to reduce our mobility and also to avoid crowdedness. So this also have things, the way we serve the patients, the way we serve the populations, including also MCH handbook. So these two reasons really require us to apply technology, in this case, to apply e-health. We can use e-health as electronic health records. It's already mentioned by all of our speakers this evening. It also can support clinical decision support system, such as in Netherlands, when the mother inputs the data of herself and the children, and then the system will answer automatically about her needs. And then e-health also can be used in telemedicine, health information system, health management information system, and of course, the mobile health or M-health. So we can see that there are so many opportunities of using ICT. We can use also ICT to set up virtual healthcare teams as a health knowledge management, consumer health informatics. So there are many opportunities that we can have by applying ICT in providing healthcare to the people. So the digital MCH handbook in mobile phone, for example, as an application of mHealth, will allow us to have rapid collection and sharing of mothers and children's data, online electronic health records, deliver messages, all the public health, lifestyle, MCH, maternal and child health messages, making appointments and alerts, transmission of the test results, e-prescribing for repeated prescriptions, medication alerts, telemonitoring of the patients, provide healthcare information to all the practitioners, researchers, as well as patients, and of course, real-time monitoring of patients' vital signs and direct provision of care. So there are so many opportunities, and it's already mentioned and proved that using digital MCH handbook for MCH care, we can decrease manual data recording, and then instead we use automated data use and analysis, improve interoperability among jurisdictions, more novel partnerships and collaborations, and then a revolution in analytics, visualizations and communication of public health data and information. And of course, the most important one, timely, highly quality, actionable data as a central of quality policy making and program management. So there are strategic directions of digital MCH handbook. First, this digital handbook require change among us from periodic health measurements to real-time integrated electronic data, from a focus on individual healthcare only to population health management, from professional interpretation to inform consumers. We make our consumers, we empower our consumers, from individual small data to distributed big data analytics. The digital MCH handbook also will improve health security. It also will provide better preventions of the leading causes of illness, injury, disability, and death. It will also strengthen public health and healthcare collaborations. And of course, it will put data and information into the hands of public health decision makers at the right time, right place to take actions. So we can see there are at least 10 benefits of using or applying digital MCH handbook. First, it will improve the efficiency of MCH care, and then it will enhance the quality of MCH care. It will make MCH interventions as evidence-based one. It will empower the consumers, the patients, especially the mothers and the families. It will encourage new relationships between patients, mothers and the family, and the health professionals. It will educate not only the patients, not only the mothers and the family, but also the physicians, the health personnel through online sources. It will enable standardized exchange of information and communication between healthcare centers. It will extend the scope of healthcare beyond its conventional borders, build a new forms of patient-physician interactions, and it will emphasize on ethics and informed consent, privacy, equity issues will be tackled by using this digital MCH handbook. And it will also reduce the gap between the haves and the have-nots by promoting equity in access to healthcare. However, implementing digital MCH handbook also have some limitation and challenges. One, the lack of knowledge by health professionals concerning the possible application of digital MCH handbook, unknown cost effectiveness, and then the cost of using digital MCH handbook is perceived to be high. The availability of ICT infrastructure and also the devices, particularly internet access, which is limited by low connectivity and bandwidth, lack of connectivity among different health information systems. For example, connectivity with the health information system of the hospital, and then absence of legal guidelines on privacy and confidentiality, change management to consider to deal with the new ICT cultural environment, limited ICT literacy among mothers and the families, and also all the potential users, low utilizations of the digital MCH handbook by the mothers and the family, and last but not least, utilization of data by health professionals as well as by health managers and decision makers. These are all the limitations, the challenges we have to take care to be able to get the benefits or the advantage of using digital MCH handbook. Anyway, together we can change the world. Thank you, and thank you.
Well, thank you very much for your so-called wrap-up of this this session. But I think you also made clear we have still many challenges to go. So I think that's also for the international community of the MCH handbook important to know where for the next steps. Well, once again, thank you all for sharing and attending this webinar this afternoon, evening, or morning. We still have something in the future. So Anneke, you can indicate our 4th seminar later this year.
Yes, the next webinar, that will be on the 4th of November at the same time as now. And it will be, the theme is No One Left Behind, the MCH handbook for special groups. So I think it's a very interesting theme again, and you are automatically subscribed for the next session. So we hope that we see you again there. And please fill in the evaluation. We put a link in the chat, but we also sent you an email. Then your reactions are very worthwhile. We learn a lot from your reactions, and we can do it the next time better. And when you fill in the evaluation, you get a certificate for attending this webinar. So thank you all for being here, and we close with the video like we have started, and see you next time. Thank you.
Thank you.